So good afternoon, I'm Chino Paolo Valerio, and I'm here to demonstrate the assessment of the skin, hair, nails, head, mouth, ears, nose, and neck. So wash your hands before and after the procedure, and gather all the necessary equipment such as tongue depressor, pen light, a newsprint, and other materials that are needed. And make sure that you will introduce yourself to the client. So good morning, sir. I'm Chino Valerio. May I ask your name, sir?
I'm Patrick.
So, Sir Patrick, what will we do today is the assessment of your skin, hair, nails, head, mouth, ears, nose, and neck. So, first is the assessment of the skin. Inspect for the any distinctive odor, color and color variation. Inspect also for the lesions and skin breakdowns. So the skin of Mr. Patrick has no skin breakdown, has no lesion, there's no distinctive odor, and the color is fair and tan. So next is the palpation of the skin. Palpate for the lesions, palpate the texture, palpate the temperature and the moisture of the skin, and palpate for the thickness and mobility and turgor. So upon observation, the patient's skin has warm temperature and the skin is moist. There is no lesion that is seen in the skin of the patient, and the texture of the skin is smooth, and there is no skin breakdown or skin integrity of the patient. Next is the assessment of the hair of the patient. Inspect first for the color and color variation of the hair, and inspect for the amount if the hair is fully distributed, and inspect for the lesions, oiliness of the scalp, and if there is parasite on the patient's hair. So inspect for the hair of the patient. So upon observation, the patient's hair color is black, and there is no oiliness that is seen on the scalp of the patient, and there is no parasite on the hair of the patient. So next is we go to palpation of the hair texture and the thickness. So upon observation, the patient's hair is smooth, and the hair is fully distributed around his head. So next is the assessment of the nails. In the assessment of the nails, inspect for the color and color variation of the nails, grooming and cleanliness of the nails, and palpate for the texture and consistency of the nail. Upon inspection, the patient's nails as normal in color, like on the other person, pink, and the texture is smooth, and the nails of the patients are clean. So in assessment of the nails, there are two types of tests: the Shamrot test and the capillary refill test. So in the Shamrot test, so Sir Patrick, upon observation, you will see when patient Patrick doing the Shamrot test, you will see a diamond shape on the between her fingernails. Sir, thank you. So next is the capillary refill test. Capillary refill test is simply pinch the fingernail of the client, and you will see it will go back to normal fast. So upon observation, the patient's nails are normal and it is easily go back to normal after it was pinched. So we will go now to the assessment of the head and the face. Inspect for the head size, the symmetry, and the presence of lumps and masses. Then inspect movement from the thyroid and cricoid cartilages, and palpate the trachea and palpate the thyroid gland if there are enlargement. So upon inspection, the patient head is normal in size. There is no lesion or skin breakdown that is present, and the face of the client is smooth and moisture. So palpate for the trachea and the cricoid card. Palpate for the trachea and the. So inspect for the neck range of motion. So sir, pwede po ba kayong tumingin sa kanan? Sa kaliwa naman po. Then touch your ear between your shoulder. Tapos yan. Then other side. Then touch your chin between your chest. And look above. Upon inspection, the patient cricoid cartilages is normal and it can move in different direction. Then you auscultate the thyroid gland and palpate the lymph node of the patient. So upon auscultation, there is no presence of birth sounds and the lymph nodes are palpable and firm in size and shape. So next is the assessment of the eyes. There are 4 types in determining the vision of the patient. So what we're going to do first is the distant visual acuity or the Snellen chart. So Sir Patrick, can you read what's written on the Snellen chart?
A, B, C, D, E.
So upon observation, the patient distant visual acuity is normal like what other person can see. So next is the near visual acuity. Near visual acuity is you must magbibigay ka ng sprint sa patient in a 14 inches. So can you read what is written?
Assessment of skin, air, nail, and mouth, ears, nose, and neck.
So upon observation, the patient near visual acuity is the eyes of the patient is very clear, so you can read what is written on the newsprint even though it is small in letters. So next is the peripheral visual field. Peripheral visual field is asking the patient, sir, can you stand? So you will ask the patient to close. Then I will move my right hand and tell me if it is moving. Sabi mo kung gagalaw yan. Pero makatabi nga itong mata siya. Is it moving? Kaya may makamakiyapos. Gagalaw yan? Gumagalaw po?
Hindi.
Hindi, may kakit. Gumagalaw po?
Oo.
Thank you, sir. So upon observation, the patient, di niya gaano nakikita if my arms is moving. So maybe there's an abnormalities on her eyes. So next is the corneal extracurricular muscle function test, the corneal light reflex, and the cover test. So in the corneal light reflex, you will just simply use your pen light. So upon observation, the patient eye is not moving, di naapektuhan yung mata niya kahit gumagalaw yung light. So that's it. So next is the cover test. Sige. Harap ako. So we will use a cardboard, simple card. So palamin. Then you will just simply follow what the pen light, where the pen light goes in different direction. So lalo mo yung ginagawa. Thank you, sir. So upon observation, the patient eyes can move in different direction, even though if it's up or down. So next is the assessment of the assessment of the external eye structure. So you must inspect for the eyelids and lashes, inspect for the positioning of the eyeballs, inspect for the bulbar conjunctiva and sclera, inspect for lacrimal apparatus, inspect for cornea and lens, and inspect for the iris and pupils, and palpate the lacrimal apparatus. So inspect the eyelid. So upon observation, the positioning of the eyeballs of the patient is at the center. So and upon inspection of the bulbar conjunctiva, the lacrimal apparatus, no tendency of excessive tearing, and the color of the cornea and lens are normal. What the other people kung ano yung katulad ng mata ng ibang patient. So next is the assessment of the ears. So first to do is you must inspect the auricles and pinna of the ears of the patient, and palpate also for the auricle and the mastoid process. So upon inspection, the auricles and pinna of the patient is properly aligned between the eyes, and upon palpation, the auricle and the mastoid process of the patient are tender. So next is we will go now to the 4 types of tests that to determine the hearing of the patient. So first is the whisper test, then the Weber test, the Romberg's test, and the Rins test. So unfortunately, we don't have any tuning fork. So what we will only do is the whisper test and the Romberg's test. So in the whisper test, I will just whisper something to the patient and the patient will determine what I whispered. So, pakinggan nyo lang po yung sasabihin ko, sir, tapos sabihin nyo rin po kung ano yung sinabi ko. So, ano po yung sinabi ko, sir? Angeles University.
Angeles.
So, upon observation, the patient hearing acuity is a little bit medyo mahina. So the patient cannot really understand what I whispered. So next, the Romberg's test. Romberg's test is simply the patient will stand in front, then he must close his eyes and peek it then for 20 seconds. Okay, sir, thank you. So upon observation, the patient balance is good. He stayed at 20 seconds in this position. And upon observation, there is a little bit swaying in the balance of the patient. Next is the assessment of the mouth. Inspect for the lips, the buccal mucosa, the gums, and the tongue using the tongue depressor. Then inspect for the gums, the tongues, and palpates the lips, buccal mucosa, and the tongue. So upon inspection and palpation, the patient lips are good. The color of the lips are red to pinkish, and the color of the buccal mucosa are red to pinkish also, and then next we will go now to the assessment of the throat, nose, and sinuses. In the assessment of the throat and sinuses, in the assessment of the throat of the patient, you must always stay at the behind of the patient. Inspect for the color of the throat, the palatine, the uvula, the tonsil, and the internal nose, and the color of the nose, and tenderness and consistency of the nose. So first we will inspect the throat for color. Then inspect the nose. So that's it. I hope you learned something. So thank you.